I'm Dr. Gerald Chodak. So you've undergone a PSA or a digital rectal exam by your physician, and one or both of those tests suggest an abnormality, and now the question is, what are you going to do about it? The doctor is probably recommending that you are going to have a prostate biopsy, and understanding a little bit more about the prostate biopsy may make it a little bit easier for you. First of all, if you're going to have a biopsy, it's a relatively quick and relatively pain-free procedure. One of the important things that many doctors will do nowadays is use a local anesthetic. We call that similar a treatment or an injection of lidocaine or Novocaine, the same thing you would get when you go to the dentist and you get a little injection under the skin. We can inject the area around the prostate by putting a probe, an ultrasound probe, into the rectum, and a small needle goes into the tissues and gives some of this local anesthetic. By doing that, you will have much less pain than a man who does not get that. Some doctors do it, some doctors don't. I would encourage you to ask your doctor about receiving a local anesthetic because it will make the procedure easier for you to tolerate. Now, once that's done, an ultrasound probe is placed into the rectum and a series of needle biopsies is obtained. We use something like it's a little gun. It snaps a piece of tissue in and out really rapidly. So the needle goes in and pulls out instantaneously. And we do that each time we do a biopsy. We're going to take a series of samples, anywhere from 10 or 12 up to 18 or 20. One of the debates throughout the United States is how many needle biopsies should we take when a man is undergoing an evaluation. You have to remember this is like a needle in a haystack because in many cases, or in most cases, we don't know where we should stick that needle. So what we do is we stick the needle in a random assortment of areas that gives us the best opportunity to sample all around your prostate gland. The average number, it keeps increasing. I would say that around the United States, the majority of doctors are now doing 12 needles, some more and some less. And I can't say to you there's an absolute right number. But if your doctor is thinking of doing only 6, I would say to you that that's generally recognized as not enough. Studies have shown that the more biopsies, or more needles you stick in there, the greater the chance will be of finding prostate cancer. So each of those needles go in and out very rapidly, and that whole procedure should take about 10 or 12 minutes, not more. And afterward, you can resume your normal activities. The side effects may be some blood in the rectum or some blood in the urine, which is usually minor. There's a very small chance of needing a transfusion, probably only around 1% or less. There's also a chance of getting an infection. And it's important that your doctor gives you an antibiotic pill to take before the procedure begins. You can also take another pill when the procedure is done, take it 12 hours later, but generally it's that first single antibiotic pill that's given before the procedure that does the best job of reducing your chance of getting an infection. Now, when you go home, you can resume your normal activities, and the only serious thing to worry about is if you get a fever. Because if you get a fever, it's possible that some bacteria from the rectum got into your bloodstream, and that's causing an infection for which you'll need antibiotics given intravenously. That can be a dangerous situation. So if you do get a fever within that first 24 to 36 hours, make sure to call your doctor and get medical attention. But otherwise, after that biopsy is done, you can resume all your activities. Another question is, should you take your aspirin if you're on aspirin? And most doctors don't feel that that causes an added burden, so you can continue with your aspirin. Another question is, if you're on a blood thinner, can you continue on the blood thinner? And there, many doctors will say, why don't you stop it for several days while we do the biopsy, just to minimize your risk of bleeding. Obviously, you don't want to be off it too long because there is a risk of getting a blood clot. That's why you're on the medication in the first place. But in general, the complication rate is low, the procedure is well tolerated, and the only issue will come up is, suppose the biopsy doesn't show cancer, then what? Do you need another biopsy? And generally around the country, doctors are following patients with PSA repeat tests, and if the PSA does go up, then another biopsy may be recommended. There is something called saturation biopsies, in which we give you a full anesthetic, put you asleep, or give you an epidural anesthetic, and we maybe take 30 or 40 needles from the entire prostate. I would say to you that that is a controversy at the present time. Why? Well, it will have a better chance of finding cancer, but it also has a much greater chance of finding something in your prostate that would never harm you, because we know that many men have prostate cancer cells who will never have a problem throughout their life, even without diagnosis and treatment. So the idea of doing saturation biopsies may certainly increase the chance of finding one of these insignificant cancers. And so you need to discuss with your doctor, if they're going to suggest that you have this, whether or not that approach may be for you. In the end, this again involves good discussion with your doctor, understanding the risks and benefits, but in the end, it is a relatively easy procedure to undergo and will help us determine if prostate cancer is present. Thank you.